Again, the triple negative is really where we struggle the most. However, we also struggle with very heavily pretreated estrogen receptor positive breast cancers. You know, they really end up with widespread liver metastases. And so one thing that's been of interest is to try to understand where the androgen receptor may be playing a role, and we're having a lot of challenges right now on the diagnostic front with the androgen receptor. And so, for example, one of my triple negative breast cancer patients did not have really the androgen receptor protein, but an extremely high level of phosphorylation of an androgen receptor. So the specific androgen receptor moiety, which is highly phosphorylated, but not really just plain androgen receptor. Now, we don't really know what the clinical implications of that are, but my guess is that the androgen receptor is very active in her cancer, and that's obviously something I would like to offer her. Fortunately, she's doing well right now, but I'd like to offer her that. Interestingly, though, looking at androgen receptor and phosphoandrogen receptor in patients with liver metastasis, finding a real concentrated, cancers in the liver with high androgen receptor, phosphoandrogen receptor. That's very likely, very, very important, very likely helping to drive the PI3 kinase pathway. It really sets up very important therapeutic strategies for patients. We have to look at it in clinical trials, to really see. But that's a really important. That's strictly at the protein level. That's an adaptive change in the cancer. You won't find that in the genome, for example. That's in the protein that has emerged over time as that cancer has gotten to the liver. I think it helps it grow in the liver, and liver is very difficult for us. So these are some examples of the androgen receptor in some of our most challenging breast cancers.